You can read me whatever you're reading to out loud so I
Oh,
can follow with
okay.
you. Yeah, yeah.
Yeah, so a healthy 25-year-old man participates in a study of muscle function. The electrophysiologic observations made on a muscle biopsy specimen are shown via that 1 millimolar micromolar of acetylcholine was applied to the muscle surface. Extracellular calcium concentration was decreased to prevent end plate potentials from acting as a supra threshold for muscle action potentials. And then based off on these findings, which of the following electrophysiologic characteristics is expected in a muscle biopsy specimen for a patient with acute botulism? So I think I was thinking in acute botulism, the problem is with like the lack of response to acetylcholine, right? Because there's something wrong with like acetylcholine release. So that was the first thought, I think. And then
Okay.
um they mentioned that they decrease the calcium concentration to prevent end plate potentials from acting as a super threshold. I wasn't sure exactly, like I think it was a little convoluted for me. So I ended up picking C, I think, because I expected like some form of decrease in all of
Sure.
these,
Sure. So
but
let's
I
talk
wasn't
about
sure at what magnitude. Yeah.
sure, sure. Let's talk about kind of a little bit here. So let's say, I'm gonna try my best here, okay? As best as I can. Okay. So, okay, let's just say this is presynaptic, this is postsynaptic, right?
Mhm.
Okay. So in plate potential amplitude, that's gonna be what, pre or post synaptic?
I think like pre.
This should actually be post.
Oh, post. Okay.
Okay. So you're getting kind of the amplitude of the response of the nerve right after release of kind of your acetylcholine, right? So let's just say these little vesicles are acetylcholine, right? And these are the receptors on the end plate that reads the acetylcholine, right?
Okay.
Okay. And then we'll talk about this at the very end. Okay. And then response to the acetylcholine, right? Is kind of how well it fires on an electrical standpoint. Does it make sense?
Yes.
In
Okay.
millivolts, right? In millivolts, right? So that's also postsynaptic, right? Your response of the nerve to kind of the receptors of acetylcholine. Okay. So now that we kind of know the normal, right? Now they're saying what happens in botulism. So this kind of question you have to be thinking like, okay, I know this sounds weird, but you're trying to put yourself, what is the test? What is the test trying to test me over? Which is the mechanism of botulism, correct?
Yes.
Okay. Talk to me about the mechanism of botulism.
So I think it just prevents the release of
Yeah.
acetylcholine.
So it gets stuck in the pre or post.
I think it gets stuck in the pre,
Yeah, it
right?
gets stuck in the presynaptic, right? So these acetylcholine little balls that hold kind of the acetylcholine get stuck here, right? So it's not released. So you know that the in plate potential amplitude, meaning that when the acetylcholine attaches to the receptor, that's going to be decreased. Does it make sense? Because you're
Yes.
not getting acetylcholine to attach to the receptor, right?
Right. Mhm.
Okay. But now my question to you is if this acetylcholine did attach to this receptor, would it have the same response to it? Yes or no?
Yes.
So
Mhm.
this wouldn't change. Does it make sense?
Right. Yeah.
Okay. So looking at that, right, just those two are going to be the easiest to start from. And then we'll talk about the miniature in plate potential amplitude, which is a little bit more convoluted. But so if you look at your answer choices here, right, you want this to stay the same, right? So that gets you between D and E. And then the in plate potential is going to be decreased and it's going to be B. B is the only one that contains that combination, right?
Okay. Yeah.
Okay, perfect. So, but let's talk about the miniature in plate potential. Okay, kind of a weird thing. I can't remember where I picked this up, but this was, I think, maybe an undergrad or something. I learned it from a long time ago. But this miniature in plate potential amplitude is kind of background noise, quote unquote, background noise for nerves, if that makes sense. So you always have some like leakage, right, of acetylcholine that doesn't cause an action potential, right? But it's just like static noise. Does it make sense?
Yes.
So that's going to stay the same, right? Because it's going to somewhat leak, right? Botulism is not going to prevent a release of all acetylcholine, but it's going to have this background noise, but not enough to create an action potential. So this should stay the same also. Does it
Okay.
make sense?
Yes.
Okay. Yeah, I guess when you're going through these problems, right? you want to think about, okay, what are they really testing here? So what's the mechanism of botulism, which is the prevention of release of acetylcholine. So, this is decreased, but it shouldn't mess with any kind of response if an acetylcholine receptor or acetylcholine molecule attaches to its receptor. It should stay the same.
Right. Okay.
All right, this one here.
So an investigator is testing the hypothesis that advanced glycosylation end products lead to an increased synthesis of ECM by human renal mesangial cells. The cells are plated on two media, type 1 collagen treated intensively with glucose 6-phosphate to produce AGEs, and a control medium of untreated type 1 collagen. To confirm this hypothesis, mRNA that encodes for which of the following is most likely to be increased in cells incubated in the first medium compared to with cells in this control medium. So I just didn't remember the substance, I guess, that's used to kind of like make the ECM.
Yeah, yeah. They're just asking you, what do you know about pretty much if you rewrite this question, right? What is a component of extracellular matrix? That's practically what
Yeah,
they're asking, right? Which is fibronectin, which is connective tissue. So, okay, not too much here, I would say. This is a kind of a less clinical question and a more, or you don't, of course.
right.
I think this is very similar to, if I'm not mistaken.
Yeah, because I
Yeah.
just know that pathway.
Yeah, this is just you have to know the pathway. So whenever kind of this the kappa beta is phosphorylase, if you look at the pictures of it, right, it holds onto kind of NF kappa beta, right? And so when it undergoes phosphorylation, it releases this molecule, which then kind of goes in and does what it needs to do. So
Right. I feel like for like these little pathways,
yeah.
they're not necessarily like discussed in depth in first aid. Is there like another resource that people use?
Yeah, to be honest with you, I would say that, these are very sparingly, I would say. I think it is mentioned, it might be mentioned kind of in the biochem section. Um, but or immunology, one or the other. But the way you want to go through this is don't go too deep dive, if that makes sense.
Yeah.
These kind of questions, you want to get the highest yield stuff, which is just this. For some reason, they like testing this mechanism, but they don't test anything else with this pathway. Does that make sense? So you don't
Right.
want to learn every minutia for this because you're only getting one or no. You get what I'm trying to say. You're playing odds, right? You're
Yeah.
either only getting one question about this or no questions about this. So you really don't want to spend more than maybe 5 minutes, 5-10 minutes on this. So
I might just
that,
like memorize, I guess, the
yeah, that's what I'm trying to say, right? Some of these things, unfortunately, it's more basic science, and they're trying to get you to. Do you remember? Did you memorize that? NF kappa beta, right? Gets released after phosphorylation of this I kappa beta. So
right. Okay.
I wouldn't say, I don't want to be like, oh yeah, pick up an immunology textbook or a biochem textbook, right? Because I don't think that that's the highest use of your time, you know,
Yeah.
um, on a test taking strategy, right? Of course, right? These kind of questions that you miss are not going to make or break your test. You know what I'm trying to say?
Right. Yeah.
Yeah, yeah. So,
Okay, for this one, I was between like B and D for this one,
okay.
but I get why it's D because
Hmm.
it's only certain people who are answering those advertisements. But I think I just got caught up with the local and regional news media.
Gotcha.
Then I got geographic. But
Gotcha. Yeah, yeah. I would say that, for some reason they do like asking this kind of question. If you set up a booth, right, that say, hey, come and take the survey, people that only with radical opinions would only come up to your booth, so that's self-selection too. um but yeah, this one, you just kind of read through it, look at it, and then kind of move forward. I think this is in what, behavioral sciences or something like that, right?
probably, yes.
Or biostats. All right, this one here.
Okay, a 3-year-old girl is brought to the emergency department by her mother 1 hour after she was found with a half-empty bottle of her grandmother's diabetes medication. The mother tells the physician that the child consumed approximately 25 metformin tablets. Physical examination shows known abnormalities. This patient is at greatest risk for which of the following serum abnormalities? Um, so I just didn't remember like the adverse effects of metformin.
Yeah, yeah.
I just assume like, okay, decrease glucose concentration, but
Yeah, so kind of the main thing that they always talk to you about this, you can get lactic acidosis
yeah,
from an overdose of metformin. This is just a, what's the side effect, right?
right. Okay, so let's see. Oh, yeah, for this one, I think I had initially put D and then I just switched it to B, but um, yeah,
Yeah, so usually your sympathetic fibers are going to relax you a little bit, right?
yeah.
Like to take the erection away,
Mhm.
right? So okay, yeah, parasympathetics usually help get the erection, right?
Right. So I guess yeah,
So
stuff.
exactly, right? Lack of input, right? Meaning that if you have too many parasympathetics, that's going to give you priapism, right? Your sympathetics is going to kind of reduce that. So obviously the sympathetics are kind of, you know, cut down here, not working. So it's kind of like a double negative on this question, huh?
Right.
Yeah, exactly.
So a 19-year-old woman comes to the physician because of a 3-day history of fever, shortness of breath, cough productive of blood-tinged sputum, rash on her legs, and pain of her groin. She lives on a small farm in rural New Mexico and says that all 3 of her cats have been infested with fleas. She is in respiratory distress. Her temperature is 102.2, pulse is 104, respirations are 28, and blood pressure is 100 over 60. Physical examination shows a 1 centimeter ulcer on the right lower extremity and numerous erythematous macular lesions over both lower extremities. There is a fluctuant mass in the femoral lymph node chain, bilateral infiltrates on the chest X-ray, a gram stain of purulent material aspirated from the femoral mass shows numerous neutrophils and a few gram-negative bacilli. Which of the following is the most likely causal organism? Um, Yeah, I don't really know why I picked B. I think I got confused because I don't know why I picked B actually, but
Hmm.
yeah.
Yeah, so this one, it's a little bit outside role. They're telling like they have give you fleas. Then you have this numerous macular lesions or buboes, right? Fluctuant 3 by 5 femoral lymph nodes, so along the leg, right? Also numerous neutrophils and few gram-negative bacilli, right? So your best answer is going to be your Yersinia, right, with the gram-negative bacilli, right? Your lymphadenopathy of your legs, right? Also, all the tenderness of the lesions, right? So that's all going to be your Yersinia. And just remember, all most things that are dealing with insects, they can be treated pretty well with doxycycline. So,
Okay.
okay. Questions, concerns. Yeah, this is just remembering your organism. Coxiella is Q fever, right? You can get coughing and endocarditis. Um, this is this is a tick. Auricula chafinensis is a tick, not a flea. Franciella, right? Tularemia, usually with rabbits. Um, Things you can think about. And then strep pneumonia, obviously, that's just pneumonia, right? And that can be anywhere, but gram positive organs, not gram negative.
Mm. Um, so the wound is clean and sutured, heals normally, leaving a faint scar by 1 year after the injury. The remodeling of the scar that occurred during the first year after injury is primarily mediated by which of the following. So I picked D because I thought it was like fibroblast activity would be the primary one for forming a scar, but I guess
Yeah, so transforming growth factor B, those are usually secreted by macrophages and, you know, this like part of the inflammatory pathway. Same with tumor necrosing factor, right? Interleukin 1, same thing, right? A little bit of that inflammation normally. And then chemokines, right? Chemotaxis, a little bit more inflammation, right? But when you're talking about the matrix melapronase, right? So it lyses proteins and then it remodels, right?
Okay.
So that's going to be scar remodeling. And the way I remember is, the matrix, right? And then you have a proteinase, right, which kind of breaks protein up and remodels them. That's how you remember it. The rest are more like inflammatory, like early on with wound healing. So
Okay. Yeah.
because usually just think of it like on a long-term scale, right? Inflammation happens within the first couple of weeks, right? Days to weeks, right? This is, a year out, months out, you're talking about scar remodeling from, collagen 3 to collagen 1, right? So
Um, for this one, I had picked A because of I think I picked it too fast without reading through the question all the way. So I just saw the leg like that. But I think that if it was going to be Clostridium perfringens, it would probably show up with, crepitus. And also, um, yeah, that
yeah,
would
so
be
taking a look at this, if you were to, if someone came into you and their skin looks like this, what does this look like to you?
cellulitis.
Yeah, like cellulitis, right? And skin flora, right? And a lot of times Staph aureus or strep pneumonia, right? Those are the main things that can cause cellulitis. Okay,
Right.
but Clostridium perfringens, right? You're talking about usually someone that got scratch and dirt or something, and this is going to be really bad. That's how you get necrotizing fasciitis, right? Because they create air bubbles, they create, necrosis, right? Really, really nasty stuff, and you're going to have spores and things like that, right? But here, if you kind of take a look at it, enterococcus fecalis, right? GI issues, right? H. influenza, respiratory issues, right? Pastorella, right? GI issues, right? Pseudomonas aeruginosa can be a couple things. It can be skin, pneumonia, sepsis, right? Staph aureus, usually skin stuff, right? Strep pyogenes is usually, strep throat, right? But you can also get like, cellulitis and things like that too. And here, one of the main things is, most likely would be, Staph aureus, but then you look here, it's in chains, right?
Right. Mhm.
So if it's in chains, not in clusters, then more likely, strep instead of staph. Staph is going to be kind of those, they're like in clusters. So do you have any questions about that?
No, I think I just need to review more micro because it's been.
Yeah, I would say micro, just think of it like that, right? A couple things, right? Of course, you're going to memorize the specifics of each organism, but I want you to remember kind of the symptoms that happen with each organism. Does it make sense? Yeah, so like for instance, like I said, Clostridium, you can get skin symptoms, of course, but they're going to give you some risk factors of, being scratched, right? In the dirt, things like that, and whatnot. And then, the rest of them, right, doesn't fit with cellulitis. The majority of them don't give you cellulitis. So
Right. Mhm. Um, 4-year-old boy is brought to the emergency department by his mother 6 hours after she knows that his urine was red. He is otherwise feeling well. 15 days ago, the patient had a sore throat, fever, and cough. His mother thought he had the flu and treated him symptomatically with rest and analgesics, and his status improved until now. His temperature is 101.3, pulse is 110, respirations are 22, and blood pressure is 100 over 50. Physical exam shows normal breath and cardiac sounds, no organomegaly, and 1+ lower extremity edema bilaterally, and lab studies show that. Most likely diagnosis. So I think it was just a linguistic thing, like proliferative glomerulonephritis. I didn't realize that post-infectious glomerulonephritis is basically the same thing. So that's why I
mhm, mhm.
strayed away from that. I was thinking like the proliferative form, but yeah. So that's why I picked E.
Okay, gotcha. So yeah. So talking about this, right? I mean, when I look at these kind of questions, I'm thinking, is it nephrotic or nephritic, right? That's the best way I start with this, right? Um, So kind of two trains of thoughts here. Nephron, nephritic. Okay, so what are the characteristics of each?
I think that nephrotic is more associated with like proteinuria.
Yeah, proteins in the urine, and then nephritic, right, is kind of blood, right? Okay, so here they're telling you it's a bunch of blood, right? So you can get rid of quite a bit of it, right? So membranous, right? Millimeter change, right? And what does tubular interstitial nephritis? What disease process is this? Was it what do you usually pee out?
Oh, you usually have maybe white blood cell cast.
Yeah. So
Reason.
WBCs. And do you remember why tubular interstitial nephritis is the same thing as interstitial nephritis, right? What kind of white blood cells do you pee out? Do you remember?
I'm not, I think eosinophils.
Yeah, eosinophils. Good. Okay. And so anytime you see eosinophils, you have to be thinking of an allergic profile. Okay. That's how I always think of it. Eosinophils, like diseases with eosinophils, like eosinophilic esophagitis, right? Asthma, right? Church-Strauss, right? All these diseases that have eosinophils, they're allergic in nature. Does that make sense?
Yes.
Okay. So if that's the case, what are the risk factors that give you this disease? Do you remember?
Um, certain drugs. So,
Yeah, like NSAIDs, right? Diuretics, right? So sulfonylurea, was it sulfa drugs, right? So, you look at this question and they don't, say that he takes a bunch of NSAIDs, he doesn't take a bunch of drugs. So in your mind, this should be ruled out too, right? Because there's no WBCs, there's no risk factors. So you should really be getting it between this and this, right? Because these cause you to pee out blood. So what gives you papillary necrosis? Do you remember that?
um,
Like
I,
risk factors wise.
yeah, I'm not sure if I remember.
No, that's okay. So, like for instance, like sickle cell
Oh,
is a
right.
big one, and sometimes NSAIDs can cause this too, right? If you because NSAIDs cause constriction, and then you lose blood, and if you lose blood, then to your kidneys, right? Blood supply to your kidneys, and your kidneys get ischemic, and then you can have some papillary necrosis, right? But yeah, you look at here, they don't really mention that. So the last thing is this sore throat, which is strep, right? And so post-strep glomerulonephritis, right? Glomerulonephritis, I mean, it can be proliferative, sure. And you can say that it's D is your best answer here
Right.
because of the risk factors. Does it make sense how I kind of work through that?
Yes.
And then membranous, right? I think I want to say it's drugs or STDs, one of them. I always forget the risk factors for membranous, right? And then minimal change, you have the right population, but not peeing out proteins, right? And you can get minimal changes these from viral bacterial infections after, usually in the pediatric population.
Mhm.
Okay. But I want you to start kind of when you read through these diagnoses, I want you to kind of think of, oh, what does this picture look like? Oh, this is, tubular interstitial nephritis, or interstitial nephritis is, WBCs, eosinophils, allergic picture, right? Usually with NSAIDs and other like drugs, right? Papillary necrosis, sickle cell, NSAIDs, things that cause, ischemia to the kidney, right? Minimal changes in pediatrics, you pee out protein after being sick with either a virus or bacteria. And then membranous, just look this up for me because for some reason I can't remember, but the risk factors I believe is, maybe HIV or, recreational drug use or something like that. But you're looking at risk factors, main thing. Okay. And I'm sorry about my handwriting. It's hard to, I mean, my handwriting in real life is not even that much better, so I can't even give an excuse, but a lot harder on the computer. Other questions about this?
No.
Okay, this one here.
An investigator is studying a new hormone, hormone X, to determine its target cell target. A purified radioactively labeled form of hormone X is added to tissue cultures. Subsequent analysis shows that the radioactivity is detected only around the region of the plasma membrane. Hormone X is most similar to which of the following hormones? So I think from this question, I assume that maybe like the receptor that hormone X attaches to would be like a transmembrane one, but I didn't remember what hormone had that receptor.
Yeah, for sure, for sure, 100%. So, I always say, right, when you're looking at these, I want you to memorize the exceptions. Okay, almost every hormone is is on the membrane of the cell, right? Except a couple, and that's going to be your steroids, or your steroid analogs, right? So cortisol, aldosterone, estradiol, testosterone, and then you have like T3, T4 are actually also, right, past the membrane. So these all kind of with thyroid hormone. So if you remember that, then everything else by association is going to be on the cell membrane. Does that make sense? That's how I remember at least.
Yes. Okay.
Okay. So those are going to be, I mean, these are all your exceptions, right? That go transmembrane, right? That are inside the nucleus or inside the cell in the cytoplasm, but the rest of them are on the cell membrane. So just remember kind of those weird ones is what I'm trying to say.
Right. Okay. A 40-year-old woman at 5 months gestation comes to the physician for amniocentesis. Results show a normal 46XY karyotype for the fetus. 4 months later, the newborn is delivered, and an examination shows a female phenotype with mild clitoral enlargement. Ultrasonography shows the presence of male but not female genital ducts. This newborn most likely has a mutation of the gene of which of the following factors. So at least here, I think it shows an ambiguous external genitalia and like a lack of um like internal male genitalia. So now I can probably answer it like the internal male genitalia is induced by DHT, which
Mhm.
5-alpha reductase to convert testosterone into THT. So if that's
Mhm.
deficient, you would see the female internal genitals. So
Good. Good, good, good. Yeah. This one they like to test quite a lot. Um, I'm trying to think of what else they usually test in this kind of clinical picture. I think oh when these males kind of trying to think of yeah, I'm just trying to remember that in my mind. But when these males they hit puberty, then usually they start returning back to normal because you have a surge of testosterone, which overpowers the amount that you need for alpha 5 reductase. And they start to have, penile enlargement and things like that. So just things to think about. Okay.
uh let's see. 47-year-old man comes to the office because of a 1-year history of difficulty reading small print. Oh yeah, for this one, I just thought that he was, um, let's see, if he holds a card more than he was like nearsighted or something like that, or farsighted. So I
Yeah,
didn't
so
really,
I think when you say, if I'm not mistaken, right, if you say that you're farsighted, that means that you can see far. If I'm not
yeah,
saying, or let me make sure, farsighted.
okay,
Let
yeah,
me
he's
make sure
farsighted.
before. Yeah, so farsighted, you're describing like what they can see, right? So they can see far, but not, but not near, right? So this guy is farsighted, it seems like, but he can't see near, right?
Right.
So that's going to be kind of presbyopia, right?
Okay, yeah,
So presbyopia is just normal changes over time. I think it starts when you're around 40 years old. So
yeah. There are a lot of
question.
like age-related sort of changes in some questions, but I'm not sure if that's like that thoroughly discussed in first aid either. But they keep on popping up.
Yeah, so I think nowadays I mean on the test they really like teaching you like what's normal. You know what I mean? Like what's normal aging, So just kind of look at, I know this sounds weird, but in your mind, right? You should be thinking about characteristics of old age, characteristics of, when you're born, and characteristics of middle age, right? So you have kind of like these three distinct categories of individuals. So when you're born, right, there's a lot of things that happen when you're a newborn that is in the normal range, right? You can get a little bit of eczema, which is relatively normal. You can get a little bit of something called milia, right, which is on the skin. You can have sneezes. You can have, watery eyes, right? All these things are normal in new birth. And then as you grow out of that, right, the new norm changes, right? Because you shouldn't have those things anymore, right? And then as you get older, right, you have your vision is not as good, right? You can't see near, which is why people have reading glasses, right? Um, you're not able to hear as well because you're starting to get, you're starting to get high sensory near hearing loss and high frequencies. That's normal with aging. Also, on top of that, right, your voice changes, your skin changes a little bit, right? It gets a little bit more. You lose that elasticity in your skin, right? Which is what happens when you get wrinkles, right? You get sunspots, right? So all these things, right? Like your bone density goes down, right? All this is part of normal aging. And so if you can kind of, just review that generally, right, on a big picture basis, I think it'll help you kind of be able to get some of these old aging questions correct.
Okay.
But in general, just not to be ageism or anything like that, right? The best way on a medical standpoint to remember aging is everything slightly gets worse, right? If you can think like that and generalize like that, you'll be like, oh, that sounds like relatively normal, right? You're not as strong, right? You lose muscle mass, you lose bone density, right? You're not seeing as well, you're not hearing as well, your voice doesn't project as well, right? Your saliva is a little bit thicker, right? Everything is a little bit worse. That's how you generalize it. So
Okay.
things to look forward to when we age. So all right.
A 34-year-old woman is brought to the emergency department. Sensation to pain is decreased over the left lower extremity. Which of the following labeled regions on the diagram was most likely damaged? So I thought it was like the lateral spinal thalamic tract that was being
Mhm.
damaged, but I guess I just didn't know the parts on the diagram.
Yeah, I think you just memorized the diagram. I think that you knew that it's spinothalamic because of pain, right? Of course, proprioception and sensation is kind of your back, right? And then, yeah, just kind of, I know in first aid, they have a really good picture and when they break these down. So just know the general stuff. This is high yield for neuro, I would say. They like testing this quite often. So just make sure that you kind of memorize the locations. You memorize, does it do pain? Does it do temperature? Does it do proprioception? Does it do voluntary motion? Right. But other than that, like they hardly ask kind of like, oh, how does this neuron traverse versus that neuron and things like that, right? The only one you have to know is the exception. Which one is, which one is contralateral, so they'll ask that. So, right, this one here.
Um, let's see. A 25-year-old man comes to the physician because of a 6-week history of daytime fatigue, irritability, and emotional lability. He has experienced weight loss, unable to fall asleep readily, and is sleep deprived. He is a medical student, has recently finished an ICU rotation where he has often worked days and nights. He's currently on outpatient rotation and will be starting vacation next week. Which of the following recommendations by the physician is most appropriate to improve his sleep hygiene? Yeah, I was between like C and E, but I wasn't sure.
Yeah. Yeah, I mean, this is tough, I would say. I think when you're talking about sleep hygiene, right, it's really the sense of how you get on a routine, regardless, you know what I mean?
Right. Mhm.
So key thing is getting up the same day every day. It kind of resets and forces your circadian rhythm to start being like, oh, because you're gonna eventually start getting sleepy, you know what I mean?
Right.
So,
Mhm. Um, let's see. A 70-year-old woman comes to the physician for advice after her husband of 45 years suddenly dies of cardiac arrest. She wants to donate $1 million to a small city's Department of Public Health to decrease the number of sudden cardiac deaths. She asked the physician to recommend the most effective way to put this money to use. She says, I want to see the results of my donation over the next 1 to 2 years. The patient is most likely to accomplish her goal if she contributes to which of the following. I had changed my answer. I initially put D and then I switched it over to E. But now that I look at D, I think that's the most like immediate um solution, right? I think if
mhm.
you could put it on like E, that would be more long term.
Yeah, that's a long term for sure. Because she wants to see over the next 1 to 2 years. And are you going to see your results, with E? No, right? Because that takes a long time. That's a prolonged period that you need to be on those drugs for it to work, right? So, best way to kind of start saving lives now, right, is you putting, defibrillators everywhere, meaning that whenever someone's having a heart attack or arrhythmia, then you have a defibrillator very close by and can probably save someone's life, right? So,
Yeah. I think I just keep on changing my answers on some of these questions.
yeah,
Like,
yeah, remember how I told you before, if you pick a gut answer choice, you got to be extraordinarily sure or 100% sure to change it. And if you don't have like great reasoning, right, and you're like, oh, maybe this is a better answer, then I would say stick with your first answer. So,
right. Yeah. So by binding to the anticodon on the human tRNA shown in the diagram, why did I pick that? Let's see.
yeah, so kind of what you're looking at here is these three, right?
Yes.
So
So,
then you kind of just flip it,
oh
right?
yeah. Uh-huh.
So it's gonna always, so if you look at it, this is 3' to 5', right? So the way that everything is always is 5' to 3', right?
Mhm.
So it has to, if you're talking about the reverse, 5' would be here and 3' would be here. Does that make sense?
Right.
So A and then U and then G. So your answer is AUG, not GUA. You get what I'm saying? So you're close, right? It's just you have to figure out which one's 5' to 3', which is this way. Does it make sense?
Yeah.
So that's the trick. You understood the question. It's just it's kind of that little tricky portion of these questions, right? So do you have any questions about that?
No, I think yeah, I just need to know
Gotcha.
that.
So just remember 5' to 3', right? Your answer should always be 5' to 3'.
Yes. A 3-year-old boy is brought to the emergency department by his father because of bleeding from a cut on his left arm after he fell off his tricycle 1 hour ago. Physical examination shows a 2 centimeter shallow laceration on the left upper extremity. The laceration has stopped bleeding and is covered with a clot. This finding results from hepatic synthesis of which of the following. So I guess now I would know like the liver synthesizes a lot of like the clotting factors.
Yeah, yeah,
And
100%.
now I would pick E, but I think before I was kind of I didn't really talk. So
Yeah, yeah, for sure, for sure. Yeah, almost all the clotting factors. Remember, the majority of proteins are created in your liver, right? Even your inflammatory, right? Like your CRP, ESR, things like that, right? Liver created, right? Factors created there, right? Albumin is also created in your liver, right? So a lot of proteins are created in your liver. So if you're ever in doubt, then you kind of think about that, right? So good. What do you see in this picture?
I immediately thought of like scleroderma because it
Yeah,
looks like the beginning of the skin.
yeah.
So then I knew it was crest,
Okay,
like esophageal dysmotility.
sure.
I didn't remember like how that would affect each one. I knew for sure that there was like a decrease in esophageal peristalsis or yeah, peristalsis, but then I guess I didn't know if it made the sphincter tone increase or decrease. But I guess now it's like I think it's caused by deposition of or like a fibrosis of the sphincter tone, so that would probably decrease it. But
Yeah, so this is always just so you can remember something else that you can think of that in the past, before I didn't realize when I took this years and years ago, they had the same question. But remember, she has a 6 months history of heartburn. So that's
right.
reflux, right? So if you have increased lower esophageal sphincter tone, then you wouldn't have any reflux.
Yeah,
Does that
that's
make
true.
sense? So if
Yes.
you decrease in the sphincter tone, that means that tone, that sphincter that's preventing, right? Here, I mean, if I can draw your, as best as I can, your stomach and then your esophagus, right? If this thing's always open, then acid's going to go up, right? So you know that it's decreased.
Right.
But yeah, people with Crest syndrome, right? They always have a bunch of reflux because of this. It doesn't close all the way.
Yeah.
So always use, going back to the always use all your, use all your symptoms, right?
Yeah.
If you kind of take a look at that, right? If you looked at heartburn, you're like, oh wait, there's no way it'd be increased because you wouldn't get heartburn. So
Right. Mhm. Yeah, for this one, I didn't know the anatomy. So let's see.
Yeah, this is just the anatomy, right? It's kind of telling you how people do embolizations, right? And so they go through kind of that external iliac, then to your internal, right, and then to your uterine artery. So, okay, good.
Okay.
Look, looks like my box drawing that I usually do.
All
Okay.
right. 10-year-old girl is referred to a cardiologist because of a 6-year history of a murmur. She's asymptomatic. Physical examination shows a grade 2/6 systolic ejection murmur heard over the left sternal border. An ECG shows a right axis deviation and right ventricular hypertrophy. She undergoes cardiac catheterization. Oxygen saturation findings are shown in the block diagram. This patient most likely has which of the following congenital heart defects? So for this one, I think I like was panicking because I was between like B and D,
Okay.
but because the right ventricular hypertrophy was like throwing me off a bit. But if I look at the oxygen saturation of the right atrium, I would imagine like if there was no ace, like if it was normal, then the right atrium will also have like 72% because the blood will
Yeah.
from
Yeah.
SBC.
Yeah, for sure, right? So here's the difference, right? Where is the oxygen bumping up to, right? And so the only thing is if there was a hole here.
Right, like a left to right shunt.
Yeah, so if here's left, here's right, right? If you have 95% mixing in with 72, you're gonna get about, let's just say around 84, right? Um, but yeah, so that's the only way, right, that you can have that. So good. But sometimes I would say just, like you said, you panicked a little bit, right, when you took this. So you kind of take a breather and say, okay, so how, I understand kind of what's going on, but how can I use this oxygen diagram to make sense? Because they do like asking this so that you understand, like, oh, what happens when there is a mixture of blood, right? There's going to be an increase in oxygen in the right side of the heart.
For if it was something like D, like tetralogy of Fallot, would that really only impact that right ventricle oxygen saturation instead of also like because there's a VSD,
Yeah.
so
There's going to
that
be a VSD, and then you might have from here on forward an oxygenation, and then she's going to have a lot more symptoms,
right? Okay.
Yeah, so you're gonna have also right ventricular hypertrophy. You're gonna have, pulmonary artery is gonna be larger too. Things like that, right? All these things are gonna remodel the heart because tetralogy of Fallot is just you have, pulmonary stenosis. You have all this stuff, right? So
Um, a full-term female newborn is evaluated shortly after birth. Pregnancy and delivery were uncomplicated during the first 5 minutes after delivery, which of the following is most likely to be increased in this newborn. So I just didn't remember. I just remember nowadays, like when a baby is born, then I think the SVR goes down. So that's partially why like the blood flow would increase.
yeah,
But
yeah, yeah. That's the main thing, right? So think of it like this, right? Like you're kind of mentioning, right? So your patent ductus arteriosus, right? Like a PDA, right? Um, why does that start to close?
exposure to oxygen.
Yeah, exposure to oxygen, right? And so when you're immediately born, right, the right side, remember, when you're in the womb, right, do your lungs get a lot of oxygen or blood flow?
No, I think the PDA bypasses it, right?
Yeah, yeah, it bypasses because I mean, you're not intaking any air, right? Of course, I think there are some things out there that says like you practice swallowing and taking breaths a little bit, right? But there's not really much blood flow going through your lungs, right? Because you're not using them. Makes sense, right? But when you're born and take your first breath, right, that kind of opens up those alveoli, and then the blood kind of falls like, oh, here's some oxygenation because you need oxygen, right? And so there's going to be a ton of pulmonary blood flow, and then that oxygenation will slowly start closing your patent ductus arteriosus. But on a good note, right, or your ductus arteriosus, I'd say, but on a good note, if you have like a really bad heart issue, right, and you're not getting enough oxygen, then your ductus arteriosus tends to stay open, PDA, which allows you to live. You know what I'm trying to say? While people try to figure out how to repair your heart. So,
Yes.
because it responds to oxygen, right? Also, on top of that, I can't remember. I think NSAIDs help close it. if I'm not mistaken. So they might ask you about that too.
Right.
So.
Mhm. Oh yeah. So a 44-year-old man comes to physician for a follow-up examination 1 month after receiving a cadaveric kidney transplant. He says he feels well. Current medications include mycophenolate and prednisone. Physical examination shows an AV fistula in the left upper extremity and a well-healing surgical wound over the right lower quadrant of the abdomen. Serum studies show a urea nitrogen concentration of 44 and creatinine of 2.6. Examination of a biopsy specimen of the transplanted kidney shows an inflammatory infiltrate affecting the small arterioles. These changes are most likely caused by which of the following mechanisms. So for this one, I knew that it was probably an acute form of transplant rejection, but I didn't remember like the immunology process behind it.
Yeah, this one's interesting because kidney transplants, when you're dealing with arterials, it's usually CD8, CD8 and MHC class one. But one of the things that you can think of is that you got kind of two, how do I say this? There's only two answer choices that kind of, well, actually, there's multiple when I look at this, but you have to match it, right? Four with two and eight with one. So it seems like all the combinations actually technically work here. But it's your host, right? The host meaning, let's say if I got a kidney transfer, it's my body that recognizes the MHC class one on something else and thinks of it, oh, that's foreign, so it's going to attack it, right? So when you're
Right.
talking about donor CD4 T lymphocytes recognize MHC2 on host lymphocytes, that's more of a graft versus host. That means that the immune system of the kidney that you got it from is now attacking your body. Does that make
Right.
sense? Which doesn't necessarily make sense in this particular instance, right?
Yes.
So you had to pick something with the host attacking you know what I mean? You had to
Yeah.
get the host attacking the graft itself. So you should have got it between D and E. Does that make sense?
Yeah, I was wondering, so it's always more so CD8 because I think in first aid it mentioned like both CD4 and CD8 can be involved in that acute transplant
Yeah.
rejection.
So for instance, let's see, like they mentioned like D, right? Which is describes the mechanism of chronic allograft destruction. T lymphocyte activate lead to cytokine production within humoral intensity 2 and 4 respectively. It occurs over months to years and is typed by vascular atherosclerosis and smooth proliferation with parenchymal fibrosis and atrophy. So I think the biopsy is going to tell you a lot here.
Okay.
Okay, so you should have smooth muscle proliferation, right? But key thing is here on a big picture standpoint, I would like you to get it down between D and E.
Right. Mhm.
Okay. The only time, okay, that it's graft versus host, right, which is kind of what you picked, right? I want you to remember that it usually gives you like skin issues,
Yes. Okay.
right? Like for instance, let's say you got a bone marrow transplant, and now the cells that you received from somewhere else starts attacking your body. You're gonna feel really crappy. Your skin is gonna flare up, and that's because you've killed your immune system, and now you've introduced someone else's T cells into your body, and now they're wreaking havoc. So, but for the most part, when you're rejecting a transplant, right? Meaning that you don't accept it, your body's attacking it. It's your body attacking the cells that you've been implanted with. Okay.
Yes. Okay.
All right. Perfect.